Hi, and welcome to another Health Talk from Mars. It's out of this world. In today's episode, we're going to be covering bone health. Did you know that 54 million Americans have suboptimal bone density? Stay tuned to find out how you can diagnose your bone density, what you can do to prevent bone loss or to treat it. Almost half of all women in the United States will experience a hip fracture by the time they're 70. 1 out of every 4 people will die within 12 months after experiencing a hip fracture, usually of a cardiovascular event or an infection because they're bedridden. So early diagnosis is a critical component to find out what your bone density is really doing. That statistic I gave of 54 million Americans have lower than optimal bone density. That doesn't include a number of other millions of people who are on the edge of becoming osteopenic. So let's make a little definition here. Osteopenia is the first stage of osteoporosis. Osteoporosis reaches a certain level. So one of the most important diagnostic criteria that we have is using a DEXA scan. A DEXA scan determines what your bone density is and compares it to women your age or to women who have optimal bone density. The reason I mention women, because women have a significant more chance of developing osteopenia and osteoporosis. But males are not exempt from this diagnosis either. So it's critical to do early diagnosis. That is, to get your bone density done at an earlier age. Now, many insurance companies don't want to cover bone density at an earlier age because they don't believe in preventive medicine. So if it comes down, push comes to shove, just shell out the money, it's not that expensive, and get your first bone density at an earlier age. And that would be between the ages of 30 and 40. Get that baseline so we know what your density is. Normally, when we look at bone density, they're given a couple of different scores. One is a Z-score, and the other is a T-score. The score that you want to look at is the T-score. The T-score compares optimal bone density to your age. In other words, we want to know what your bone density is doing compared to the ideal bone density. So the reason why early diagnosis is so important with regards to osteopenia and osteoporosis or low bone density is that there are no real symptoms associated with osteoporosis. There are some symptoms that may give you a clue, such as leg cramps or periodontal disease, which is gum disease, or low back pain. But those are symptoms that oftentimes happen later on when already osteoporosis is being established. So early diagnosis is really a critical stage in terms of, getting an idea where you are on the spectrum. Okay, so what are the different factors that are involved in bone density health? And how can you maximize your bone density? Well, for one thing, your diet is a critical component to your bone health. And what do we know? We know that if your alkaline ash, if your ash pH in the body is more alkaline, this tends to excrete less calcium ions and maintain your bone density better. When your ash is more acidic, then you have a tendency to excrete more calcium. And this results in less calcium for your bones and the beginning of osteopenia and eventually osteoporosis. So you want to eat a diet that has an alkaline ash. What does that mean? Well, that means more fruits and vegetables. Fruits and vegetables, we know, give a more alkaline ash. When you eat a higher protein diet, especially from animal meats, what we find is your ash is more acidic. That more acidic pH results in an increased excretion of calcium ions from the body. So you want to make sure that you eat plenty of foods that have potassium in them, because potassium in particular is going to cause you to have a more alkaline ash. So eat your fruits and vegetables for sure. So the other thing is to make sure that you are consuming a diet that is of whole foods and unrefined. So what we know is that most people are grossly deficient in potassium. We should be consuming anywhere in the neighborhood of 6 to 8 grams of potassium per day. Most Americans get 2.2 grams of potassium. Potassium is found in fruits and vegetables, and these are the foods that you want to concentrate on. So in terms of other plant foods, certain grains such as wheat can actually cause your pH to be more acidic. So you have to be careful, and there are definitely handouts that you can look at that give the acid and base balance of foods. In fact, I'm going to include one down at the bottom. We can see a list of foods and what their pH is. So a whole foods plant-based diet's really quite important with regards to maintaining this more alkaline pH. So the reason why whole foods are really important is because they contain certain trace elements that aren't normally found in most foods. Most commercial foods are grown in soil that's greatly depleted in minerals. Many of these trace minerals play a critical role not only in the bone density, but also in the tensile strength of your bone. So tensile strength is different than bone density. If you take marble and you x-ray it, marble looks extremely dense. If you had bones as dense as marble, you'd be a rock star. The only problem with that is if you drop marble on a hard floor, what happens? It shatters. So this is the same as what we see in your bones. You can have marked bone density, and this is actually something that has been shown to happen with people that are taking bisphosphonates. Bisphosphonates are medications that are used to increase bone density. Yet they've shown that the rate of hip fracture is actually greater in people taking some of these medications. So it's not enough to just get more bone density. You want to get more tensile strength in your bone. So there's a number of trace elements that are critically important with maintaining this tensile strength of your bone. Some of those nutrients include magnesium, manganese, strontium, boron, molybdenum, silica. They all play a critical role in maintaining optimal bone tensile strength. Again, we want to make sure that you have bones that are dense but also have high tensile strength. So eating foods in a wide variety of foods that are grown in soils that are highly repleted in trace elements is critical. And that brings us to the point about soil health and what you can do to enhance your soil. And that is to make sure that you're using organic farming practices, which basically supply many of these trace elements. But really, one of the things you can do to assure yourself to make sure you get these trace elements is to consume a multivitamin and mineral supplement that's highly replete with these trace elements. If you look at most multivitamin mineral formulations, they're woefully lacking in a lot of these trace elements. You can look on the label and you can see that, and those are some of the ingredients that I tell people to look for. How much boron is in your multivitamin and mineral supplement? How much silica? How much manganese? How much magnesium? All those elements, they need to be in high enough quantities that they make a difference in the bone tensile strength. So check your labels and see. I've created a multivitamin that's extremely high in trace elements. It's called Omnivite, available from marznutrition.net, and you can check that out later on after you've watched this broadcast. So some other factors that are critically important are some nutrients that are known to make your bones more dense. Vitamin D, for example, is a critical nutrient. Vitamin D is sometimes hard to get. If you live in an area where there's not a whole lot of sunshine, that could be problematic. Vitamin D is actually a hormone. It's made in your skin. So the sun irradiates the cholesterol in your skin to something called cholecalciferol, which goes to your liver and eventually your kidneys. So making sure you have good sun exposure is actually critical to make the active form of vitamin D. But even people that are out in the sun all day long oftentimes are found to have low levels of vitamin D. So one of the things that should be on your blood work is to make sure that you check your vitamin D status. The reference range for vitamin D is extremely wide, from 30 to 100. Ideally, I like to see people's vitamin D levels somewhere between 50 and 70. If your level is considerably below that, I would strongly recommend taking a vitamin D supplement and then checking your vitamin D status after several months to make sure that your level indeed has come up. Some other nutrients that are critically important are vitamin K. Where does vitamin K come from? Vitamin K comes mostly from green leafy vegetables, but there is an active form of vitamin K called MK7. So oftentimes you'll see on a label MK4, MK2, MK7. MK7 is the one that you want that's going to maximize your ability to make a protein in your bone called osteocalcin. Osteocalcin is a particular protein that binds onto calcium ions. So you want to make sure you have optimal levels of osteocalcin in your bone. And to do that, you need to take in a significant amount of vitamin MK7. So keep that in mind. MK7 is also available in a few foods. Certain mushrooms have MK7 in them, and so is a compound or a food called natto. Natto is a fermented soybean product. Mostly is eaten by Asians, but it can be found in stores and is something that will enhance your ability to make that osteocalcin. Other critical important nutrients would include both calcium and magnesium. Calcium and magnesium are in a delicate balance with each other. Taking too much of one without the other can create a deficiency. So you want to make sure that you're getting at least 500 milligrams of calcium from a supplement per day. The most people in the United States tend to get lower levels of calcium and also magnesium. And you want to get your ratio of calcium to magnesium about 1:1. So if you're taking in 500 milligrams of calcium, make sure you take in 500 milligrams of magnesium. That's important. So again, look on your multivitamin and mineral formula. See if there's vitamin K in the form of MK7. Also look to see if there's enough boron. Boron, again, is a critical nutrient, trace element, should have at least 1 milligram in there per serving. So take a look at your label. Manganese is also important. 20 milligrams is a pretty good amount. Silica, as I mentioned, also very important for bone density. So again, a really good multivitamin formulation should have all these ingredients in there to make your optimal bones density. A couple of things that I'd like to mention with regards to lab are that there are certain toxins that are made in the body that can cause problems with osteoporosis. One of those compounds is called homocysteine. Homocysteine is a metabolite of methionine, which is an essential amino acid. So it may be that people that have higher intakes of animal protein in particular have extra amounts of methionine. Extra amounts of methionine means that you might be making excessive amounts of homocysteine. Homocysteine is something you don't hear about because, one, there's no drug that treats elevated homocysteine. Homocysteine is regulated in the body by certain nutrients, and they include folic acid, vitamin B12, and vitamin B6. So all three of those vitamins need to be basically methylized. That means that methyl groups need to get added to them to make them into the active form. If you're not getting those forms of vitamin B12, so that would be methylcobalamin, or folate, which is methyl tetrahydrofolate, or vitamin B6, which is pyridoxine. So check your labels in your multivitamin to see if they are in your formulation, because those are critical, especially in people that have an MTHF reductase deficiency. So there's a number of people that carries a gene that doesn't methylate properly, and you can check that via a genetic test. But really checking your levels of homocysteine. Ideally, we like to see your levels of homocysteine below 8.0. So you can request that from your physician. Say, I'd like to get my homocysteine levels checked. Homocysteine is also a risk factor in osteoporosis and also cardiovascular disease. So you want to make sure your levels are low for those two things as well. Another very important item with regards to osteoporosis and toxicity would be diabetes or prediabetes. In an earlier podcast, we talked about the fact that half of all Americans now have either pre-diabetes or actual diabetes. That's a crazy number of people. So what we know is that in problems with blood sugar issues like prediabetes and diabetes, often people experience problems with their kidneys. So a simple test that measures kidney function is something called a BUN, blood urea nitrogen, or creatinine. Both of these compounds, when measured together, give you a reading called the glomerular filtration rate, or GFR. Your GFR should be at least above 60. What we know about GFR is that if your level is at 60, it doesn't mean that you're perfect by any means. You can lose 90% of your kidney function and still have a level of GFR at 60. So that's really quite startling. So there is another test that you can request your physician to make, and that test is called cystatin C. Cystatin C, we don't want that number to be above 1.2. So you can get that checked out. You can request that. It's a relatively inexpensive test and can be added to any blood work that you have done. Okay, so those are some important lab findings that you want to take into consideration. Now, I would be completely remiss if I didn't speak about something that's highly critical for bone density, and that is physical weight-bearing activity. So physical weight-bearing activity is critical for proper bone density. As we know from astronauts, people that went into outer space, even for 2 to 3 days, experience a very significant drop in their bone density in a very short period of time. So we want to make sure that, one, we engage in physical activity on a routine basis, and two, we want to make sure that physical activity is indeed weight-bearing. So now there's a fine line between doing weight-bearing exercise and causing problem with your joints. So if you're overweight, that could be extremely problematic because that could cause problems with your joints. So that you have to be careful with. But just need to know that if you're doing an exercise, let's say like swimming is done in an environment that reduces weight-bearing. That's not going to really have much of an effect on your bone density. So it is really critical that some of your physical activity, at least a few times a week, is done with weight bearing. That's one of the reasons why I recommend doing yoga. And there are different types of yogas that use different weights. So weight bearing yoga exercises can be critical to enhance your bone density. So if you're taking these particular supplements that I recommended before, and you're not doing weight-bearing exercise, that could certainly be problematic. So aside from weight-bearing physical activity, and that's something that you need to be able to do that you like to do. So walking, going on a treadmill, doing, again, exercise that you've got some weight onto your joints and onto your bones is critical. Now, I would also be very remiss to leave out the fact that hormones play an essential role in your bone density. So for both males and females, it's very important to have normal or optimal levels of hormones like testosterone. Testosterone is an anabolic steroid. Anabolic steroids build tissue, especially protein tissue, especially bones. So having low tissue levels of testosterone could significantly cause bone loss. And again, that's in both males and females. Ideally, I like to see males having a testosterone level between 7 and 900. And in females, I like to see their testosterone levels at least above 20. 30 to 40 could be more optimal. So you can ask your physician to check for this hormone, see where you're at on the scheme of things. Thank you for watching another episode of Health Talk from Mars. It's out of this world. I hope you found the information today useful. If you like what you heard and you want to support us, click like and subscribe below. If you want to purchase Marz nutrition product, Omnivite, my multivitamin formulation, you can contact me through marznutrition.net, and also Cardiomagloplex, my key mark magnesium supplementation. Thanks again for watching.